First, we will be talking about the postmortem changes and the mechanism of spoilage. Now, what are the postmortem changes? What are the spoilage? I had already discussed what headings we all are going to learn in that, but why this postmortem changes are going to occur? So, as we know that immediately after removal of the water, fish cannot survive for a long time. So as soon as it dies, now how the fish dies? Because when we remove from the water, now we know that the respiratory organ in the fish is gills, which is specially adapted for taking the dissolved oxygen. So it is not possible for the fish to take the air oxygen. It does not happen. It is not possible for the fish to convert until and unless it do not have the accessory respiratory organ. It is not possible for a fish to take the air oxygen. So because their respiratory organ is not supported for taking the oxygen present into the air or the gaseous form directly, they can take only and only the dissolved oxygen. So what happen, it causes the suffocation and they are unable to breathe. And what is going to be happen if they are not able to breathe? So definitely their circulation will cease, right? Means circulation, heart will stop pumping. So common symptom of such death is the blood congestion into the gills and the gills cover. Whatever gills are there, gills will become very congested and the blood capillaries often burst and it causes the appearance of the blood stain. Now, if the fish is dead. So after the death, considerable changes will occur. Now, what would be that changes? Now, see, these changes are depend on the size and the type of the fishes. It can be the physical condition, it could be the season, and it could be the death condition. You have removed it, and then after you have spread the fish on the seashore, you might have taken the help of the electrical net. So definitely it depends on the death condition also. So what happens after the death? It follows the certain changes like the different type of body physical changes into the body of fish. Now, freshly dead fish, you will find that the muscles they continue to show irritability for some time, and it's stimulated by the electric current. If means the death of the fish has caused because of the electric current, so blood circulation will cease immediately. So the activity of the muscles is also lost through gradually. So the body of the fish enters in a state that will be called as the rigor mortis. So what is going to be happen after the death? The brain control, blood circulation, everything will stop. So because of this seizement of the blood circulation and all, so the fish will not be able to resynthesize the ATP. Now we all know ATP is what? It is the energy currency. So because of death of the fish, stiffening of the muscle tissue will occur, and this stiffening will remain for some time only. And thereafter, the pH value of the fish will change. Then what is going to be happen? Rigor mortis we are going to discuss in the detail. Then thereafter this postmortem changes, what is going to be happen? Muscle will also lose the stiffness, and that is going to cause the autolysis, that means the degradation of the amino acid and lower molecular compound. And thereafter more changes. Then microorganism will grow inside the fish. Then thereafter autolysis, at the end what is going to be happen? there will be changes into the whatever fatty acids are there. So that means the rancidity will occur. So let us discuss all these changes one by one in detail. First, we will talk about the hyperemia. See, sometimes the hyperemia is also spelled as Hyperemia. Hyperemia. So it is that's why it's pronounced as hyperemia or hyperemia. Both are correct. Now, what is this hyperemia? In short, hyperemia is the increased blood flow. Now, why we are studying the hyperemia under this heading? Because the first step when you are going to catch the fish, so the first step will be the hyperemia. So hyperemia is what? It is the increase access of blood into the blood vessel or any part of the body. So hyperemia in short is the increase of blood flow to the different tissues into the body. So it can have the medical implications, means not necessary that at the time of death only it is going to occur, but it also a regulatory response, because if the more and more hyperemia will occur, so it can help into the vasodilation and it may help to sustain the life for some time in the case of fish. Now, when we talk about the types of hyperemia, there are two types: active hyperemia and the passive hyperemia. So, when we talk about the active hyperemia, it happens when there is increase in the blood supply to an organ. It is a temporary type response. This is usually in response to a greater demand of the blood. Example, when you are doing the exercising or same for the digestion. So, likewise, it's a temporary response, you can say. Then the passive hyperemia, when the properly blood cannot exit from an organ. So what is going to be happen? That blood vessels become very bulky over that side, and this type of hyperemia is known as the congestion. It may also cause because of the excess fat, that your blood is getting coagulated, and it can cause the medical problems, this passive type of hyperemia, and it can remain for a longer time. Now let us discuss the causes. There are many causes, but I have enlisted only few. So as far as active hyperemia is concerned, it is caused by the increased blood flow into your organs. Now it is usually happen when organ needs more and more blood than usual. Now when we require more blood, now we required at the time of exercise, so your blood vessel start widening up to increase the supply of blood flowing in. Now what could be the causes? First and the most important, I had already told you, is the exercise. Because when we exercise, that particular time our heart muscles requires more and more oxygen, because with that time when we are active, so at the time of the activity, blood rushes to the heart and other part of the body, also circulate very fast to cope up with the extra oxygen demand. So that time muscle needs up to 20 times more than the normal supply of the blood whenever we are doing the workout. Then heat, when there is a high temperature, could be the fever also, or maybe the reason is that you are sitting in a hot place, or the environmental temperature is high, so that particular time extra blood will flow to the skin. Why? Because to maintain the osmotic balance. So for that particular reason, the extra blood will go to the skin, so that we can cope up with the temperature, and the sweating and extra metabolic activity remain continue. Then thereafter digestion, that means when we eat, that particular time stomach and intestine requires more and more blood to help them break down the food and they absorb nutrients, because there is a high temperature in the stomach. Then inflammation we had discussed in a very good detail into the immunology unit. So what is the inflammation? Inflammation is the increasing or doing the vasodilation in a particular part of our body. So during an injury or any type of infection, inflammation is occurring. So blood flow to that particular site increases. I had already discussed in the immunology why blood flow is increasing that particular site, because blood is having the warriors in that, right? Then thereafter menopause. Menopause is the condition when the women stop menstruating. Means at after a particular age, it depends on woman to woman. So now see, this menopause do not applicable for the fishes, but as I'm discussing the hyperemia, I'm discussing this point. So women who are menopause often have hot flashes, which causes blood flow to the skin, especially the face, neck, chest. Blushing is a similar response when you blush for any happiness. Then release of blockage, hyperemia can happen following ischemia, which is a poor blood flow to an organ. Once ischemia is treated, blood rushes to that particular area. Then next type of hyperemia, that is the passive hyperemia. It happens when the blood can't properly drain from an organ. Means blood has reaches to one organ, but it is not able to drain out very easily. So that particular type, what happens that the vessels, vessels become the bulkier. So what could be the causes of such type of hyperemia? It can cause due to the heart failure or ventricular failure. Now here in the case of the fish, this type of hyperemia is occurring. Heart failure is happening, ventricular failure is happening. Then left and right ventricles are the two main pumping chamber of the heart. The right ventricle pump blood. Now these all are not applicable for the fish. All right. So because they do not have lungs, so in that case what happened that in short the blood circulation ceases. Then deep vein thrombosis, which is caused by the clotting into the deep veins. Then hepatic vein thrombosis, that is your liver blockage. Now what are the main symptoms in case of the hyperemia? Redness, then warm. Other symptoms depend on the cause of the problem. Heart failure symptoms include the shortness of breath, coughing, wheezing, swelling in the belly, leg, ankle, feet caused by the fluid buildup, fatigue, loss of appetite, nausea, confusion, fast heartbeat. Then deep vein thrombosis, which includes the swelling and the redness in the leg, pain, warmth. Then heart vein thrombosis symptoms include the upper right part of your abdomen is paining, then swelling into the lungs, cramps, itching, etc. Now, I hope hyperemia is clear to you. What we have learned into the hyperemia, that hyperemia is the increased blood flow, and then we have discussed its causes as well as the symptoms. Next category I told is going to be the rigor mortis. Rigor mortis is what? It is the postmortem changes. Now see, this is a very characteristic phase of the postmortem changes in the fish, during which the fish will lose its flexibility. First step is what going to be happen. First, it will happen because of the suffocation. You can say, means immediately after the death, the fish will starve and glycogen reserve, whatever are present in the body of the fish, it will deplete, and it may also occur because of the stress. Now what stress are there? Many challenges are there. Fish is out of water, so breathing challenges there, maybe any she's answer means feeling the suffocation, and many other issues are there. So the method used for stunning and killing the fish, it influence the onset of the rigor mortis. Now this will be a characteristic phase of the postmortem changes in which the fish first thing will lose its flexibility, and temporary it will become very stiff. Now this stiffness progress in the cephalocaudal direction. Cephalocaudal direction means more stiffness you will find into the head region is compared to the caudal region. Then it's starting from the lower jaw and the operculum. Then you will find that the mouth of the fish will remain open and fins, gills covered spread out, and the body axis and all will be, you will find, become very stiff part. Now, the amount of time taken for rigor mortis is depend on many factors. It is influenced by the method of the killing, then hypothermia, and other factor. It could be, the other factors can be the body size of a fish. It can be, you can say, the species. Now, if the fish is having the accessory respiratory organ, so it will take the more and more time for the fish. Then duration of the time of the fish body, how much time it may remain. So 18 hours can remain, and depends if the on the health of the fish also, means what are the type of fish as well as the health of a fish. So now there are various steps. Immediately after that, the fish muscles will totally relax. The first fish will soft and playable, and texture will be formed and elastic to the touch. Then at that particular time, that means the first stage time, the flesh is said to be pre-rigor condition. It is possible to make muscle contract by stimulation of this stage, means a little bit muscle contraction can be seen this particular age. For example, if you will give electric shock or something, so you will find that the fish is having muscle contraction. Then thereafter, in the second step, what is going to be happen, muscle will become very stiff and hard. The whole body will become inflexible. The fish will be in rigor stage. See, pre-rigor stage, then in rigor stage. Now the muscle will no longer contract even if you will give the electric shock, and it will never ever regain its property. After several hours or days, the muscle gradually. Now, see why I have written days here, because if it is packed or preservatives are being added, so this rigor mortis stage can be maintained for the longer time. Whatever quality process we are going to learn, we are trying to maintain this rigor mortis state, because this is a suitable stage. Okay, so after several hours, or you can say that after several days, the muscle will start gradually begin to soft, and this will become limp again. And the fish has already passed through the time rigor, and it is said to be into the post rigor stage. So three stage students we have learned. One is the pre-rigor condition. At that time, that fish is just no bodily changes will happen. It is just like fresh, or you can say life condition. Muscle can be contract a little bit by the electrical shock. Then in rigor stage we will have learned that is the body is hard stiff. Then post rigor, now this is the stage which is close to the autolysis. Now here what is going to be happen, the fish will start spoiling. Okay, now this stage, the fish is good for human consumption. Now after rigor mortis, the decomposition will be more intense and rapid. Means this stage if is over, so that time thereafter the rapid changes into the fish body will occur, and soon the fish will, as the fish passes this rigor mortis stage, the fish will be useless, inedible, and rotten from the point of view of human consumption. Now the fish will spoiled one, and rigor mortis therefore is the index of the freshness and high quality of fish. See, what is the index of the good quality fish? Is the rigor mortis. It is taken as a test for determination of the freshness of the fish. In the other words, for making the distinction between a fresh and the spoiled fish, what we are going to do in the later. So there are various criteria to check whether the fish is into the rigor mortis stage or not. So the first criteria is the means first we do the organoleptic test. We are going to discuss all this test in detail. So rigor mortis by its late will cause the autolysis. Okay, so longer duration for improving the quality of fish. What we can do, we can save it. Now we will study the next stage, that is the autolysis. This is the stage, or you can say this will occur after the rigor mortis. So rigor mortis under normal condition can remain for 7 to 18 hours. As I told you, it depends on the quality of the fish and as it has tips. So 7 hours, so fish remain, and it can last up to for 30 to 120 hours. If we are going to take the careful fishing operation involving the minimum dragging and handling, avoidance of throwing and bruising the fish prior to that, and to all the period of the rigor mortis, then tend to prolong the period of the rigor mortis. So we can use the different we can say the normal nets which do not comprise of the electrical shock and all, so that time the rigor mortis can remain for the longer time. Now next category, post trigger delay and spoilage, that is the autolysis. Now, what do you mean by auto? Auto means self. Lysis means breakdown, or you can say the self digestion. So, many years it has been known that two types of fish spoilage: bacterial and enzymatic. Enzymatic means in situ within the body of the fish, whatever enzymes are present. Bacterial can be in situ as well as the outside bacteria can also harm the fish. So the enzymatic changes proceed and thereafter predominate the spoilage of the fish. Now autolytic enzyme activity due to the bacterial multiplication is the prime factor for the fish spoilage. Means the enzymes which are present in the body of the fish as well as the bacteria, they are also producing the enzyme which are present in the body of the fish intestine and all. We know that the organism, they have the natural or residual fauna present in their digestive system. So all this causes the rigor sorry autolysis. The what happened because of that, these particular changes, they make the fish more and more susceptible to the bacterial attack. Now outside bacteria will also attack them. Bacterial activity starts the decomposition. Now what happened exactly, what would be the stages? So first the protein will break down. Now protein will break down, so what will produce? Protein will give out the, now see, proteins are made up of amino acids, right? Proteins are nothing but the amino acid chains. So proteins will give out the amino acid and as well as the other nitrogenous end products. This could be the urease and xanthin, etc. Then thereafter what is going to be happen? It will produce the ammonia, it will produce the carbon dioxide, means the waste metabolic product will form. So thereafter all this will start spoilage, or you can say all this will cause slowly change into the taste. So what type of changes can produce? It make the fish bitter or pungent with the taste with the advanced spoilage. Now all this enzymatic decomposition will also change the structural, as well as it may cause the softening of the flesh. So it could be the change into the texture, it could be change into the taste. So this is about the autolysis. Then the next thing is the rancidity. We know what is the rancidity. Rancidity, see, you must remember autolysis, amino acid or the protein degradation. fat degradation is called as the rancidity. Now, what will happen in the case of the rancidity? Now, just now I told you what is rancidity. It is the breakdown of the fat. Now, where the fat is present, we know that the fish comprise of lots of oil in its body, cod liver oil and all we might have heard. So, whatever fat is present, so whatever reaction occur into the fat, it gives the unpleasant odor and the flavor. Now, this fish oil is more liable to the spoilage than the other oils. Why? Because many unsaturated fatty acids are present with the low saponification number and higher iodine value. Now, this oxidation of fat in the fish like sardine, mackerel, tuna, katla, etc. is a good example of kind of chemical spoilage. The oil of this fish body will start oxidizing. So because of this oxidation, now why this oxidation and from where the oxygen is going to come? This oxidation is occurring due to the atmospheric oxygen. So exposure to atmospheric oxygen will result into the brownish discoloration of the fish. Now when this discoloration will start occurring, definitely it is going to alter the taste. So not only it will alter the taste, it will cause the rancid smell. Then color of the fat will also change from light yellow to the rusty iron. Also a thin oil turns into the thick and the sticky. Rancidity is a very difficult problem to tackle in the fishery. The storage of fat in the fishes with highly unsaturated, as now I told you that it have the many type of lower saponification number and higher iodine value. So because of this oxidative changes, the breakdown of peroxide occurs and it ends into the number of decomposition related problem. So because once the rancidity start, it is impossible to use that particular fish. So this will make the many problems. And now what common measures we can take to control the rancidity? First of all, we can add, as I told you, that rancidity occurs due to the oxidation, so we can add the antioxidants. Now what type of antioxidants we can use? We can use the polyphenols. Then polyphenols, how we are going to use? We are not going to dip the fish into the phenols, okay? We can soak the fish into the aqueous solution, coating with the thick viscous fluid, or lacing the fish with the ice. This ice contains the antioxidant. Now antioxidant used into the cold storage or the salt curing yards. The storage chamber gas filled is with either nitrogen or carbon dioxide, so no oxygen exposed to the fish, so no chances. Means normal freezers are not used, they are using the nitrogen or carbon dioxide. So absence of oxygen will also prevent the oxidation. Then what we can do, we can we can make use of the quick freezing techniques. We are going to learn quick freezing techniques in detail. So immediately after removal, at the time of rigor mortis, we want to sustain the rigor mortis stage because it is our index of quality, right? So for that time only, what can we do? Immediately we will store the fish at the minus 20 degrees Celsius. Then we can add the pure salt for the curing of the fish. So all this thing can be prevent for the fish spoilage. So what we have learned about the post-mortem changes. In that we have discussed about the hyperemia. Hyperemia is the vasodilation. Thereafter we have discussed about the rigor mortis. These are the post-mortem changes immediately after the death. Then thereafter autolysis and the rancidity. So these are the post-mortem changes. Next lecture we will discuss about the test. What test we can do to check the fish is having a proper freshness or not. So for this note, for today we will stop.